Hi, my name is Daniel. I'll be your student physical therapist today. I've heard that we had some shoulder pain, so let's kind of get in talking about that. Then we'll hopefully get some tests and measures done with that, assess what we think is going on, and then we can provide some interventions, hopefully get you feeling a little bit better. And then we'll just talk about some things you can do at home to kind of improve that, okay? Awesome. So just going to get into a couple questions with you real quick. First one, what is your age?
21.
Okay. And are you male or female?
Female.
Okay. Awesome. And tell me just a little bit about what's going on today.
Well, my shoulder has been hurting for the last couple of months during swimming practice, and it's just gotten worse.
Okay. Definitely. And can you point just with one finger where that's hurting? Right there on that front side.
Mm-hmm.
It's kind of localized there, or is it spread over the entire thing?
It's just localized.
Just localized. Okay. Perfect. Okay. And are you right or left hand dominant?
Right hand.
Okay. Okay. Tell me a little bit about this pain. Is it like a sharp pain or a dull pain?
It's like a dull and achy, and it feels unstable.
It's feeling unstable, you said? Okay. And did this injury or does this pain happen from an abrupt injury? Like did something happen and I have pain, or is it kind of like a gradual onset?
Just kind of a gradual.
Okay. And has it gotten better or worse since it started?
Worse.
Worse? Okay. All right. What would you say your current level of pain is, kind of from a scale of 0 to 10? 0 is no pain at all. 10 is we got to get you in the emergency room right now.
Currently it's 0.
Okay. So I'm guessing 0 is the best. What's the worst it can get to?
7.
7? Okay. And is this pain, is it kind of constant or is it intermittent, like on and off?
Kind of on and off. After practice, it stops around 10 minutes.
So you said you are doing swimming practice. Is this competitive swimming, like you're practicing quite a bit?
Yes, every day.
Every day? Okay. Tell me a little bit about kind of your 24-hour pattern. So like what you're doing throughout your day that helps ease it when it's at its best, and then what's going to make it at its worst throughout the day?
Usually at its worst, it's when I'm at practice, or if I'm at the gym weightlifting. At its best, I'm just resting or at work.
Perfect. Okay. Do we have any numbness or tingling?
No.
Any shooting pain down the arms, anything like that? Just kind of that localized pain in that place.
Yeah.
Okay. So you said swimming is hurting. Is it just a certain style of stroke, or is it kind of all swimming?
Just swimming.
Just swimming in general? Okay. Can you kind of show me the movement that aggravates it? Just kind of that reaching around.
Yeah, like reaching overhead too.
Reaching overhead too? Okay. Having anything that aggravates it outside of swimming, just kind of in your normal daily life?
Like putting things on shelves if I need to.
Okay. And when it starts to hurt, how long does it take? Like when you start to do those motions that make it hurt, how long does it take for it to hurt?
Instantly.
Instantly?
Mm-hmm.
Okay. You mentioned something about the gym. What is hurting in the gym for you?
Mostly shoulder exercises and some bicep exercises as well.
What kind of shoulder exercises hurt?
Like pressing, like reaching over, anything overhead, and then biceps.
What about out to the side, like a lateral raise? Any issues with that?
Not as much.
Not as much? Mostly that overhead stuff. What are you doing to help ease the pain?
I'm taking ibuprofen before practices and meets just to get through it, and then I'm icing afterwards.
So when you do these things to help ease it, resting, icing, how long is it going to take from that 7 out of 10 to get down to 0 out of 10?
10 minutes.
10 minutes? Okay. So you said you're taking ibuprofen for this. You're taking anything else to help with pain? How about your sleep? Is your sleep being affected from this at all?
No.
Sleeping nicely? Okay, perfect. How about your job? Is anything at your job being affected from this?
No.
Okay. What do you do for work?
I'm just sitting at a desk.
Behind a desk. And no problems with that at all?
No.
No problems with typing, anything like that?
No.
Okay. All right, so we talked about weightlifting, we talked about swimming. Is there any kind of other activities, hobbies, exercises that are kind of being limited because of this? Things you want to get back to? Just those are the two main goals. Do you have any past medical history with this? Any prior injuries to that shoulder or anything like that?
Like a year and a half ago, it was hurting, but it was resolved with the athletic trainer.
Athletic trainer help you?
Yeah.
Did he get that to a 0 out of 10, totally resolved?
Yeah.
Okay. Taking any other medications that I should know about unrelated to? Are you having any recent unexplained weight loss?
No.
How about any problems with bowel or bladder functions?
No.
Okay. Do you smoke?
No.
And do you drink?
No.
Okay. Do you have anything that could influence how we do PT? Any cultural beliefs? Anything that we need to watch out for when we're doing PT?
No.
How about your living situation? Do you have help at home to get through the everyday tasks, or is it kind of like a lone wolf such a situation?
It's usually just me.
Okay, it's just you. Do you have any support at all from family or friends for anything?
Yeah.
You do? How about transportation? Are you going to be able to make it to PT sessions? Do you have a way to get there?
Yeah.
Okay. And then, most importantly, what are your goals with physical therapy? What do we want to get out of the long term and maybe even the short term? You have some quick goals and some long goals.
Well, just getting back into swimming and improving without any pain, and then improving in the gym as well.
Okay, so I'm just going to do a recap. If you think that I'm missing anything, you want to let me know. Let me know. We can make sure we have that in there to best help you. And if anything is incorrect from what you think, just let me know and we can make those changes as well. So you're 21. We're having some pain right on the right side, just on that front part. It's localized, and it's getting worse. It's kind of a gradual pain. Kind of describing it as like an achy pain that is pretty much instantly onset. It takes about 10 minutes to go away. The best it can get is 0. When you're resting, the worst is a 7 out of 10. You are taking some ibuprofen and icing it, which is great, help with the pain to go down. But things like reaching overhead, shoulder pressing exercises, or swimming strokes is going to aggravate it. Specifically, swimming strokes is the main thing. You're taking ibuprofen, I think we said that. Sleep is not affected, sleeping like a baby. And you're typing at a computer for your job, so not noticing any problems with your shoulder from that. You also want to be able to get back to just like reaching, putting things on a shelf, doing activities as you are at home without support at home in your living situation, although you do have support outside of that. No problems with bowel or bladder or recent weight loss that we aren't trying to do. We don't smoke, we don't drink, no cultural beliefs that would affect PT training, and we are able to make it to PT sessions. Does that seem like it covers everything, or do we need to add anything? Seems good? Okay. Awesome. So just to recap, our asterisk sign is going to be that overhead swimming motion, stroke, I guess you would say. No red flags yet, although we will see if we see any during the intake, the entry screen, as well as the vitals. So I'm going to go ahead and make my hypothesis up of what I think could be going on. If you want to just give me a few minutes to get that going, we'll get into some vitals, things like that, and hopefully get some tests done, and then some interventions to hopefully help you feel a little bit better. Okay? Awesome. Okay. So my first hypothesis is a labral pathology. We'll be doing a few tests to rule that in or out. The second hypothesis is an anterior shoulder instability. Third is rotator cuff dysfunction. I won't list all the tests we're going to do right now, but I'll tell you them as we go through them, and we'll see if we can either reproduce the pain or figure out what's going on with that, okay? Awesome. So before we get into the specific tests, we're just going to go through a few vitals, posture, things like that. So go ahead and put this pillow on your lap, just right on this side. Perfect. All right, and then I'm going to go ahead and stick this right on your finger. Perfect. Awesome. Is it okay if I roll your sleeve up?
Yeah.
Awesome, thank you. Does that feel all right?
Yeah.
Okay. Awesome. Just go ahead and relax as best as possible for me. So feeling all right?
Yeah.
Go ahead and take that from me. Awesome, thank you. All right. And just I'll take this one more time. Just go ahead and relax for a second. Awesome. Okay. Perfect. Okay, next we're just going to do our neuro screen. Since we don't have any numbness or tingling or shooting pain, all you need to do is a dermatomal assessment. Would you mind just rolling your sleeves up for me? Perfect. Just have you put your hands on your lap whenever you're ready. Good. I'm just going to be touching on one side or the other of you. I just want you to tell me if it feels the same or different. Okay, go ahead and close your eyes.
Same. 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 Same.
Good. Awesome. And do you have anything under there, under your shirt? No? Okay, that's totally fine. I'm just going to have you go ahead and stand up for me. And then I'll have you do a couple steps. Perfect. And, can you roll your sleeves up for me again, please? Perfect. And then just a couple steps, and then stand exactly how you normally would. Awesome. Okay, go ahead and take a seat for me. Next, we're just going to be doing a little bit of palpation. I'm just going to be palpating around here. I just want you to tell me if there's any pain with any spots, okay?
There.
Right there. A little bit of pain right there. Right around here?
Yeah.
Okay, perfect. Awesome. Okay. I'm just going to do our musculoskeletal. I'm going to have you put your biceps up just like this. Good, resist. Good, and resist. Good, and then pick your elbows up. Good, and resist. Good, and resist. Good. Now I'm going to have you cast your arms out for me. And resist. And resist. Good. Okay, I'm going to have you go like this with your fingers. Perfect. And resist. Resist. Good. And flip them upside down. Wrists up. And resist. Good. Resist. Good. I'm going to have you spread your fingers. Don't let me close them. Good. 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 Now you make an airplane. Hands up to the side. Go ahead and resist. Any pain with that? And resist. Perfect. All right. All right, I'm just going to do a movement analysis. Don't mind just standing up for me. Can you show me what that looks like when you're reaching and putting something on the shelf that's causing the pain? And are we having pain with that right now?
No.
It's only when there's something in your hands?
Yeah.
Okay, and then we've already done the swimming stroke, but show me that one more time. Any pain with that movement on its own?
Not really, no.
Just kind of when you're in the water? Okay. All right. So we're just going to get into some range of motion. So I'm going to have you take this arm and have you reach it forward as high as you possibly can. Okay. Same thing with this arm. Go ahead and relax. Any pain with that when I push?
A little bit.
A little bit of pain? I don't know if that's too much. Alright, next I'm just going to have you go with this arm and then go from the side, raise it up as high as you possibly can. So as far as you can go.
Mm-hmm.
Okay, same thing with this side. Awesome. Okay, and I'm going to have you reach your arm out to about here for me. Okay. I'm going to put some pressure on. Just go ahead and resist. And I'll go out to the side for me. And resist. Good. Any pain with that?
No.
Let's see this one out front. Go ahead and resist. Good. Any pain with that?
A little bit.
Okay, and out to the side. And go ahead and resist. Any pain with that?
Not really.
Okay, so I'm just going to have you take this arm, I'm going to have you reach it all the way out. I'm going to have you punch forward for me. Perfect. Go ahead and resist. Good. Same thing with this side. Punch out for me and resist. Good. Any pain with that?
No.
Okay. All right. Next, I'm just going to have you have your elbow next to you with this one. Just a little bit out. Good. Go ahead and resist. Good. Same thing with this side. And go ahead and resist. Good. Any pain with that?
Mm-mm.
Okay, perfect. Awesome. Next, I'll just have you lay on your back for me. Get this stuff out of your way. All right. Go ahead and stick this right under your arm. Perfect. bring your arm just out to here. Okay, I'm gonna have you try when I say to go to touch the back of your hand to the floor, okay? Does that make sense?
Mm-hmm.
Okay, go ahead. Good, hold that there. Okay, and then we'll do the same thing, except now we're gonna try to touch the palm of our hand to the floor, okay? And go ahead. Hold that there. Same thing with this side, just right under your arm. Go ahead and try to touch the back of your hand to the floor. Keep that there. And then back on up. And then try to touch the palm of your hand to the floor. Hold that there. Give me 1 second, you can go and rest. Okay, when you flip on over to your stomach, in 1 second. Just like this. Okay, I'm gonna put your hands like this. I'm gonna be pressing down on your wrist right here. Just want you to resist that, okay? And resist. Good. Here. And press down now here. Go ahead and resist. Good. Any pain with that?
No.
Okay, we're gonna do the same thing with this side. I'm gonna bring your hand out to here. Go ahead and resist. Pain with that?
A little.
And resist. Anything like that?
Yeah.
Right. You're pressing like this on your scalp. Okay, just want you to resist that. Resist. Okay. On this side, go and resist. Good. Right. Go ahead and sit up whenever you're ready. Give just a second to get all these notes in, and we'll keep moving. Okay. All right, next we're going to do some joint mobility. I'm going to have you lay down on your face one more time. And we're just going to be pressing down on kind of the back of your shoulder. And we'll flip on over to the front. So just go ahead and relax. It shouldn't hurt at all. How does that feel? No pain with that?
No.
Okay. This side. Any pain with that?
Yeah.
Some pain?
Yeah.
Okay. All right. Now you flip on over to your back again. All right. And just relax. Just to your side. Anything with that? What was this? Some pain? Is it a bad pain? Not really? Okay. Okay. All right. All right, now that we've done all these tests, kind of how's your pain level right now out of 10?
2.
2? If you go ahead and do that swimming stroke again, it's hurting. Is that still at a 2 when you're doing that motion?
Yeah.
It's about a 2. think that's just kind of from us messing with it a lot,
Yeah.
kind of pressing on it. Definitely makes sense. Okay. All right. Next, we're going to get into our special tests. We'll in or out on hypothesis. We're going to start with the biceps load test. I'm just going to have you lay back down on your back for me. Right. And then I'm going to put your arm just like this. Good. And then we're going to try to, I want to have you try to touch your hand to your shoulder. I'm just going to resist that, okay? Let me know if there's any pain or anything with that, okay? Go ahead and resist. Any pain with that? We got some pain with that? Is it kind of right in the spot, the same spot? Or is it in a different place?
It's the same spot.
What'd you say?
Same spot.
Same spot? Okay. Perfect. All right, next one's going to be the crank test. So I'm just going to take your arm back out here. Okay. And would you mind if I just move this pillow just to lay it up? Perfect. Is that still comfortable? All right, I'm going to press down in. Let me know if there's any pain with this, okay? Got some pain with that?
Yeah.
All right. Okay. Next, I'm just going to have you stand up for me. You put your hand on your hip for me. Good. I'm just going to be pressing up in. Okay. Let me know if there's any pain with this. Try to resist this motion. Any pain with that?
A little bit.
A little bit of pain. Okay. A little bit of weakness as well there. Okay. Next one is going to be the sulcus side. Okay. You mind if I roll this up?
Yeah.
Okay. Perfect. All right, and just go ahead and relax for this one. Okay. Just place it there. Does that feel okay? Any pain with that?
No.
Okay. All right. Next one will be the jerk test. Well, I'm just going to pick up your arm like this. Just go ahead and relax for me, okay? Any pain with that?
Yeah.
Got some pain with that? In that front part right there?
Yeah.
Okay. I'm going to go straight into Hawkins Kennedy. I'm going to go ahead and move your hand just like this. Any pain with that?
No.
Nothing with that? Okay, just pressing in is when it hurts. Okay. Just gonna have you have your hand just like this, right here, this one for me. Perfect. Go ahead and resist this motion. Any pain with that?
No.
How about with this one? Resist. Any pain?
No.
Okay. Okay. All right. Next, I'm gonna pick your arm up just like this. When I drop it, I just want you to, or when I let go of it, I just want you to keep it in the same spot. Okay. Good. Any pain with that?
No.
Okay. All right. Okay. So it's going to be the ER lag test. So I'm just going to take your arm and I'm going to move it out like this. When I let go, I just want you to keep it in that same spot. Okay. Good. Any pain with that?
No.
Okay. So you're going to go behind your back. And put about an inch off your back. Try to hold that right there for me. Good. Any pain with that?
Oh no.
Okay. All right, I'm gonna have you lay down on your back one more time. It's gonna be the anterior apprehension relocation test. I'm just gonna move your hand through this. Okay. How's that feel? Any pain with that?
No.
Okay, perfect. Awesome. Go ahead and sit up. All right, give me just a second to review over what was positive and negative before I give my diagnosis, okay? All right, so judging from the tests and the range of motions and the MMTs, I would list your diagnosis as a right shoulder labral pathology. We could be suspecting a slap tear, but we also do have some anterior shoulder instability and a little bit of rotator cuff weakness, especially in internal rotation. So we can definitely work on that today, and I'll give you something to take home with you too, which we can progress with and hopefully strengthen what needs to be strengthened and limit pain as much as possible. This falls into the ICF category of pain with muscle power deficits. All right, let's go ahead and get into the intervention. The first thing we'll start with is the posterior joint mobilization. So I'm going to have you lay back down on your back again. This should feel therapeutic. There shouldn't be any pain. So if there is pain, just let me know and we'll make the adjustments as needed, okay? And this will be 2 sets of 30 seconds. Just go ahead and take this. Relax. How does that feel?
Good.
That's okay. We're going to take a break for just a second. We'll get into the next one. How's it feeling after that? I mean, it's kind of tough to know right away, but does that feel therapeutic? Like it's helping? Okay. We'll go to the next one. How does that feel?
Good.
Yeah. Awesome. Okay, next we're going to do a thing called Wise T's Eyes. Okay, so I'm going to take this pillow out from underneath you. And so what we're going to be doing is I'll have you use this face hold. At home we'll be doing this as well. You can just kind of have your head hang over the edge of a bench. We'll be lying face down and I'm going to have you make a T. Okay, and come back down. We're just going to be really focused on controlling that downward motion as well. And I'm going to make a Y, control the down, and then an I. And then I'll be laying face down, okay? We're going to go for 2 sets of 10 reps. When we do a T, a Y, and an I, that'll be 1 rep. If you feel like it's too hard at 10 reps, we can adjust from that. But we're going to start with no weight, and we can progress to some weight in the next few weeks, okay? So give that a try, and we can make sure it's not causing any pain and that it feels right. Perfect. I know it's a little bit difficult with that bench or with the table. Any pain with that?
No.
Okay. Good. I'm going to have you stop for just a second and let's try to move up to this face one to hopefully get the bench a little bit out of the way. I know we're a little tight on space. Does that feel a little bit better?
Yeah.
Okay. Good. And we'll just keep moving. That's rep 4. Good. I believe that was 10. Did you count 10 there?
I think so.
Okay, perfect. Go ahead and sit up for me. All right. So this is something we'll also start incorporating. Very simple. It's just usually done incorrectly most of the time. We're going to go across the body, and we want to do both arms with this, so we don't have any imbalances. We're going to go across the body, but instead of curling in like this, I want you to keep that chest nice and tall. You should feel that stretch right about in the back of your shoulder, okay? And see if you can get it just a little higher with your arm for me. Perfect. Just keep that chest nice and tall. Do you feel that stretch?
Yeah.
Okay, we're gonna hold that for 45 seconds, and I'll get the timer started for you. Awesome. 15 more seconds. And go ahead and stop. Good. How does that feel?
Good.
Any pain with that? Just a good stretch? Okay. We don't want to be eliciting like a sharp pain with that. We don't want to be cranking our arm over too far, or we're going to do that. So just for a therapeutic effect, and we can kind of keep working on that. Something you can do at home as well, which we'll talk about in just a second. Next, we're just going to do maybe some wall slides with the band. It's going to help with our shoulder stability. So I'm going to have you take this yellow band. Let me make sure the camera can see this. Just move that over a little bit. We're just going to loop our hands through just like this, okay? And then one at a time, we'll come out and up. Hopefully not hit the light. Up and up, okay? We're going to go for 8 reps. Out and up is 1. And we really want to do that both sides as well. I'm going to have you do both sides today as well, okay? So get that shot. Good. Yeah, good control there too. Good, very good control. How does it feel? Does it feel difficult?
A little bit at first.
Okay, we can always go to a heavier band once we start to progress on that as well. Okay. Next one is I'm just going to have you lay down on your side for me, with the right side facing up. Now we're going to start with no weight on this as well, and we'll progress pretty fast on this. But I just want you to try to keep your elbow locked into your side, and have you move your hand to the ground and as far up as you can, okay? We're going to be doing that for 15 reps, okay? Good. Is that difficult?
No.
It's not? Okay. Do you have any dumbbells at your house?
Yes.
You do?
Yeah.
Okay. Well, we will, I don't think we do here, but you can either use a dumbbell or you can use something as simple as like a bottle with weight in it. Yeah, just hold that overweight or overhand. Yep. And then add a little bit of weight to that. Just make it a little harder.
Yeah.
Okay, perfect. Good. Just go through 15 of that. sit up. How does that feel? Good. Is that challenging?
Yeah.
Okay. And as we get stronger with that, we can progress to like a cup of, or a can of soup even, or that dumbbell that you said you have at home. Just don't overdo it. Keep that good control like you did. Okay. This one we don't have the facilities here, but you said you were at the gym quite a bit, correct? So if you can hook a cable up to about hip height or just above it where your hand is, and have it running that way, then you can practice the same thing but coming in towards you instead of out like we just did.
Okay.
And that'll help with that internal rotation, which I'll be talking about on your home exercise program. So just to kind of recap, our cross-body stretch is going to help with that mobility. We work pretty tight on the external rotation and weak on the internal rotation, so this will help to stretch that out. Our rotator cuff is a little bit weak on both IR and ER, so those two exercises are going to help to strengthen that. And then our Ys and Ts are just going to help with coordination and strength, specifically in the rear delt and the external rotators. And the wall slides are also going to help with stability throughout that range of motion. So did it feel like those were helpful? Is there anything you want to change with that? Feels good? Okay, perfect. That will be very close to what we're going to do on your home exercise program. I'll be writing something up on HEP to go. I'll give you a document so that you know exactly what you need to be doing. But we're going to be going through those. I'm going to have you go just at those rep ranges that we just did and those time limits. But I would like you to do once in the morning, once at night. This will ensure that you can kind of keep progress going and keep moving forward instead of just doing it and then not doing it for a while. Will be hard to make progress. So you have 2 sets of everything, and you have 2 sets twice a day, so 4 sets a day total. You split those up, get your proper rest time, keep control with that, okay? Awesome. Do you understand the instructions? Everything seems, any questions with that? No questions, okay. Did it feel like it was helpful to you?
Yeah.
Okay. Anything that reproduced pain with that? Okay. Go ahead and give me that swimming motion again. Does it feel like it's any better, the same, or worse? A little bit better? What would you say your pain level is out of 10 right now?
1.
Like a 1? Perfect. We will take that, especially with how much poking and prodding we did around with that. So I will hopefully see you again either next week or sometime this week. Let me know how those at-home exercises go. Push yourself on it, but just not to the point of injury. We want to be making progress, but we also don't want it to be super easy where we're just going through the motions. So we progress by pushing ourselves in a safe way. Okay. Do you have any other questions for me? Okay. All right. Well, I will be excited to see you next time, and thank you very much for everything.